If you could start adding in loading up your slides, that would be great. As I mentioned that Probir has been deeply involved in India's Sustainable Energy Initiative and leverages leading subject matter experts to connect the dots through deep analysis that paints the big pictures and sets goals to come up with roadmap options to be implemented at national levels. Probir obtained his chemical engineering degree from IIT in Kamrapur and his MBA from Denver University. He has participated in many executive programs, panels, and working sessions in India and US, and has been interviewed many times on India national television. You will hear how he has got involved in the COVID-19 studies with his analysis and observations on the COVID issues that led him to suggest a containment solution for this pandemic. He welcomes constructive input, open criticism, and future collaborations. So it is my pleasure now to turn the podium over to Mr. Ghosh.
Unmute your mic, please. Microphone.
Yeah, I'm trying to. Can you see my presentation?
Absolutely.
Okay, now I need to figure out how to unmute my microphone.
You are unmuted.
Oh, can you hear me now?
I can.
Everybody? Okay. Randy, thanks for the introduction, and my hats off to all the organizers who have worked so hard in real time to work things. My presentation is going to kind of look at, as an outsider jumping in, I always try and get and learn from the subject matter experts, and Ravi Mahalingam has been one of them, and there's been about 30 or 40 others I've worked with to try and understand COVID. And I'm looking at an aspect from healthcare and economics and balancing that. And this is an excerpt from the white paper that I'm doing. Let me go to the next slide. This is the white paper that we are doing, and we will look at why the Western civilization, specifically US, was so unprepared for COVID-19 pandemic. I'm not going to spend time on that. The ones you are seeing in bold is where I'm going to spend time on. Since this is a multi-nation discussion, especially between India and US, I'm going to spend most of my time on the highlighted ones. So I'm going to spend time on observations and analysis at global level, and kind of what lessons can we learn, since there are so many unknowns and so many things happening. That's why it's still a question mark and it's always a moving target. We are going to look at the national level if we have a little bit of time. We are not going to cover the state level, and we'll quickly jump to the conclusion on what are the things we are learning, what do we do going forward. Anytime, if somebody cannot hear, or please do let me know. So I'm not going to spend time much on this. There are several reasons why Western civilization, specifically US, was so unprepared for COVID. And I think it has got a lot to do with our First Amendment rights. We have got as the highlighted part shows, we have got about, of the 27 amendments we have, which are, this is the First Amendment, and is perhaps the most important amendment that give freedoms to the public. And there are 5 areas, and this is probably one of the biggest reasons why we have had such an issue dealing with COVID. I'm going to leave it at that, and I'm going to jump to the next one. And at the global level, what we are going to see is I want to do touch base on flattening the curve. The impression that decision makers, especially the politician and business guys, see is whenever they see flattening the curve graphs, they see I will cover that, and the slide I will cover. Then I will also jump to the China story, since it's started there, and then the main place where I'm going to spend time on is I have actually looked at about 40 to 60 countries and tried to benchmark them where US stands, and looked at, for example, the healthcare GDPs, healthcare spending, and COVID metrics, and comparing them. And the other last one is we need to kind of normalize either on per million or per 100,000 basis for new cases, new tests, and such. So this is something that we are going to cover. The first thing that this was, as you can see in this slide, that on the right-hand side was an actual picture when White House first time on March 31st said, if we do not do anything, we can have fatalities of anywhere in millions. And if we do a stay-at-home request, note the word request. Here, it's not an edict. Because of the First Amendment, everyone is very careful about how we say things. And you can see that it whenever the flattening the curve or stay-at-home request comes, the decision makers get this perception that this will prolong the economic shutdown, and there are all kinds of resistance that start with it. In reality, here is what really happens. When you do nothing, which means getting to herd immunity, it takes a very long time, and it can be a multi-year process. So you see this red dotted curve that really happens instead of a nationally mandated, let's say if we could have done a SD 80 level lockdown instead of the SD 50, 60, which many of the states tried to do, and we could have stopped it in about, we could have come out of the bell curve or at least reduce it dramatically by June, July timeframe. This is the reality that happens. What you are seeing in the next one is the dotted blue line. We tried to exit the curve well before new cases dropped down significantly, and the surge started again, and with this yellow bar you see is where we are about right now. We are seeing the surge started around mid to end July, and we are seeing that in August timeframe it started reducing. But if we do not bring it down to a significant level, and I'm going to talk about the levels in the next few slides, we are going to see a curve, and the curve spike up again, especially as the fall and winter season starts, and the business starts, the school starts, colleges start. So this is an issue that we need to think about. Now let's look at a little bit of China. The key question I'm asking, everybody asks, is how reliable is the data from China? And my perception from whatever research I'm seeing is at the scientific level, there seems to be a fairly decent interactions going on, but the moment the politicians and decision makers and business entities get involved, a lot of things get shut down, and the data related for testing and a lot of things are not shared, and that can create, that I think is creating a lot of problems. Most of these know, most of people here know that China, The first alarm started by Dr. Lee on December 31st, but the virus may have actually started 30 to 60 days before, because even in the US, I've heard from several doctors that when they started seeing symptoms in January and February, many of them did not relate it to coronavirus, but as our knowledge came back and they started revisiting things, they said those are most likely COVID-19 that happened well in the early days. But from the time Dr. Lee sounded alarm, you see that US actually got some information as early as January 3rd, and by January 11th, the gene sequence was given to WHO, and within and then there was a lot of suppression by the local authorities. But when the experts came from China, Shanghai, the person who was involved with SARS and MERS before, and he declared that this transmits human to human. The lockdown happened in June 23rd. So what I'm saying is from the time within about 24 days, the lockdown happened, and the things you are seeing at the bottom are, it took about 20 days from the time WHO got the gene sequence to declare that this is a global level emergency, but it took about 40 days from there. WHO waited 40 days from there for WHO to declare that this is a global pandemic. And then there was a lot of confusion about masks, and finally around April time frame, early April time frame, that masks requirement became a standard. This chart is essentially showing is my screen shaking for the rest of the guys?
Yes, a little bit, but we thought that was your animation.
So it is not an animation. I avoided animation, but for some reason the screen is shaking, and I don't know why that is. But what I want to show here is this was China's, a few key things that I pointed out is from the time there was a lockdown that happened on the 23rd, and 23rd, the peak for active cases happened for the nation, China, by February 17th, about 25 days from the lockdown. But the actual new cases started declining about at least 7 days earlier. So within about 20-21 days, the lockdown they did, the new cases started declining, and within about 50 to 60 days, 75 days, China was out of the COVID cycle, out of the bell curve, and the new cases had dropped down dramatically. I wonder why this is shaking so much. In this chart, what I did was, one of the first things I did was I tried to separate out Hubei, which is Wuhan. Hubei is the province where Wuhan city is.
Would you like me to share my screen? I have your slides.
Okay, can you do that to see?
Can everybody see my screen?
You have to, I think, jump in and let me know.
Can you see my screen?
Not as yet.
Yes.
You can see my screen?
We could see your screen, but not these slides.
Okay, let me stop share and share again. Can you see it now?
Yes.
Okay. Let me put it in.
Is this a PowerPoint?
Yeah.
Okay, can you go to?
Yeah. Can you see it now?
Yeah. So, okay, let me continue. Thanks. I will just say jump to the next screen the moment I finish. The only thing I wanted to point out here is that the lockdown, from the time of lockdown, the new cases started declining within about 20 days. And as you go to the next slide, and what I did here was I separated out Hubei province where Wuhan is and where it all started, and we saw that Hubei lockdown time was about 75 days, but the rest of China exited lockdown within 54 days. By March 2021, they declared starting to start a phase reopening. And the bigger thing I found was the infection in rest of China was dramatically less. Both infection and fatalities were dramatically less, and the question always was why. I will leave it at that, and let's jump to the next slide. So what I did here was incorporate how US started. The first case we discovered in January 21st, and you can see that by the time, the point I want to make here is by the time, by mid-February, even for a person jumping in early January and started looking at things and data points, I could see both John Hopkins data and many other databases, and this data was available, and you could see that the peak had reached by early February, and we could have seen this data and acted on it much faster than what we did. I will again leave it at that and jump to the next slide. And what I then did was, what happens if I said, what happens if US could have mirrored? This was done around March 20th. What happens if US could have mirrored the Hubei fatalities and cases, and we would have seen about roughly for US, the case per million would have been so much, and our death rate would have been less than 20,000 if we could have mirrored. I'm not saying we can do that, but I'm looking at mirrored. But the more interesting part was, if we could have mirrored rest of China, our death rates would have been less than 28, say 100. So that raised a lot of questions to me, and I said, how are other countries, especially the free world countries, doing? So let's go to the next slide. As I said, I did look at about 50 different countries and try to understand as much as possible. This graph, I don't know if you can see my cursor, I started to look at, of the countries I looked at, I decided the most similar countries in the free world are the 5 largest economies in Europe, and Germany seems to have, the red line, Germany seems to have, sorry, this is a red line is US, the brown thicker line is what you see in Germany. The bars you are seeing on the this side, on the left hand side, the 50, 100, 150 and so on are the the cases, new cases per million. So you can see that the red bar, which is US, we peaked in the first surge at close to 100, but we never came down. The lowest we came down was in the 60s, and we started opening up and we can see the surge starting, and right now the surge levels are at 200 and above, and that's an area where that's one of the reasons why you can see that why US could never control it. Even the other countries, for example, this green line you see is actually Spain. Everybody talked about Italy. Italy is this. The green line is the top. The top one in the first surge, where it reached the highest peak. But they could control it and brought down to less than 50, and you can see that most of them actually brought it down to less than 10. And if you look at IHME initial and many others, they had actually started, the green line you see here right at the bottom, the straight line right at the bottom. It is one straight line at the bottom. That is less than 1 per million was the initial target for any country to have a complete reopening. And China kind of followed that, but there are a lot of Far East Asian companies also followed that norm to keep things in control. So let's go to the next chart, and next chart. This is the same chart. No, before that, go back to the other one. Yeah, this is the same chart. What the top table is new cases per millions per day. You can see that I started tracking from 310 about the time where US started, and you can see that Italy reached the peak first around 326, and US reached the peak about 15 days later. So everybody was focused on what was happening in Italy, and if you look at the Italy side, you can see that they had peaked. These are in millions, new cases per million, and you can see that Italy by mid-June, if you look at the 617, mid-June has brought it down less than 10 per new cases per million. And even when they surged by end July, even when they surged, a lot of people and politicians talk about, oh, Europe is surging by, if you look at the last 10 days, they will say that, oh, Europe is surging by in 200% and so on. Italy is surging by 200%, but their new cases per million is still less than 10, so it becomes manageable. I will not spend so much time on the death per million, but you can see that there were countries, especially UK, France, Italy, and Spain, had more deaths per million than US, but US now has already overtaken. And as the point I'm wanting to make with the previous chart and this table is US is the only country in the world where COVID resurge is happening above the manageable levels. So let me go to the next chart. This is probably a little bit, I don't know if you can see anything much at all on this, but what I did was I looked at about 37 countries, including US, and broke it out by different regions, North America, Europe, Middle East, and then South America and Asia Pacific. What I noted was I looked at the GDP and their healthcare spending, and what I noticed was there seems to be no in fact, U.S. has the highest healthcare spending. If you look at column 9, U.S. has the highest healthcare spending among all the countries, and if you look at Germany, the healthcare spending, even with universal program, is less than half of, these are per capita spending, less than half of US, and so is most of the countries in Europe except for Switzerland, which is fairly close. But if you look back at at Germany and say, could we have emulated what Germany has done? And if you go to column 20, 21 and 22 at the last, what I did was, what happened if US could have mirrored each of these countries? This was done around, this data is around May 10th. The reason I chose May 10th is because that is the time when most of the countries started coming out of the European countries and US started coming out of the lockdown or stay at home social distancing. And you can see that the ones in the red on column 21 is if US would have mirrored UK, France, and Italy, their numbers would have been much higher than what US was at that time. So was with Spain and Netherlands and essentially European countries. But if we could have emulated Germany, our death rates would have been much less, and it would have been about less than 30,000, and that's one area. Then, if you look at Asia Pacific, which is from row 20 onwards, row 25 onwards, and actually, and go back to column 20, 21, and 22, you will see that the fatalities and cases were dramatically lower. So the question I started asking was, is there something else going on? If you look at column 22 and row 25, so Japan, so row 25 onwards, you will see that the cases and death rates were much lower, and the numbers of fatalities, if we normalize it for US population, which is row 21, would have been significantly lower. So the question we started asking is, what are the reasons this is happening and with Far East Asian countries? With that, let me go to the next chart. So CDC and WHO essentially says two things. One is the case load should be reduced for reopening. Case load should be reducing consistently over 14 days, and test positivity below 5%. And what we are going to see is this doesn't happen. This is not enough. And we need to really start tracking cases, normalize everything to new cases per million, and for that matter, all other key metrics, and have a set standard to try and track that. So what you saw in that one chart with the 5 European economies, the most stringent standard would have been less than 1 per million new cases, but it seems to be manageable if it is less than 10 per million. So 10 per million for US with a 331 million population would be roughly about 3,300 cases. But at no case should we let it go below above 50 per million, which is the yellow bar. and that's something that we need to start looking at. And I've given some examples why just reducing by 14 days does not work. Say, for example, in the latest July 24th to August 6th, US new cases dropped by 25% and fairly consistently, except for a few states spiking here and there. But the cases per million went from 235 to 178, which is still very high for any reasonable opening, especially at office, school, college, travel, large indoor gatherings to happen. And the same thing applies to positivity rate, and I will address that in the next slide. Can you go to the next slide, please? So this is what I did for a 13-day average of the different countries I was tracking about. You can see that again, the green in this case now the bar is horizontal instead of going up vertically. The green line you see just after the countries is the less than 1, which is the most stringent norms many countries follow. And I've noticed that New Zealand and many other countries where you are seeing cases, the numbers you are seeing at the end of each of the bar or where there are no bars. For example, New Zealand, you can see that number of new cases have been 0 over the 13-day average, or less than 1, because less than 1, if it is less than 0.5, it will show up as 0. And you will see that many of these cases in Asia Pacific, again I've broken it down by the top above this dotted line, horizontal line you see here is all Asian countries. You can see that that Singapore is surged beyond 50 are in the danger zone, and India is still in the surge mode, but have not crossed the danger zone in my mind just because of population. So normalizing new cases per million is very, I think, is one of the key metrics we need to introduce to make this work. So if you look at Europe, so the other country that's happening, the one with the arrows are the few ones I wanted to talk about. You will see that Israel, there's a huge spike of new surges, and a lot of it has got to do with school reopenings, and that's something that we don't have time to discuss in details, but there's a lot of data that we are looking at. Why are the reasons this spike is happening? Luxembourg, which is a country of, again, you can see 125, a country of 600,000 just besides Germany, is spiking. And this is a very interesting fact to me because Luxembourg tests, get this, 25 times more per million tests. If you normalize it, tests per million per day, Luxembourg tests 25 times more than US. So despite such aggressive testing, they are still facing a spike. So why is that is what we are looking at. And you can see Germany, Luxembourg, as you know, if you have traveled to Europe, is a small country just bordering Germany. Most other countries have got it under less than 10 per million in Europe, and that's something. So where you are seeing the major spikes happening is essentially South American countries along with US, and this is an area that there are lots of tables tables and graphs that we are looking at. We are looking at each country in detail, and we may not have time to cover it, but just to give a flavor of what's happening. So let's jump to the next slide.
Probir, could you summarize?
Yeah. Can you,
Ravi,
can you
go to a
just jump
summary.
on? Yeah. Can you just go on to the last 2 slides, please? Keep going. Okay. No, I will just address these. This one and the slide after that. Can you go the one before, please? So the key here is all these. We have talked about R0, and R0 R0 is a function of all these. And what we need to see is the funding over the last 10 years have actually decreased as much, especially in US and many countries, by as much as 20 to 25%. And this is something that the funding needs to happen at a much major level to have a better control of the virus and react much faster. So go to the next slide. Here is something that I will share this slide later with you all. And what do we do for testing immunity? What do we do for which is serology and antibody tests? What do we do for infectiousness? What should the targets be? And what should be the rate of? Should we keep the positivity at 5%, or should we bring it down as our number of tests increase? Are the other things that we are looking at? I'm sure that people will be discussing about how do we make this test go from the current 2,500 tests per million per day for US to as much as 6,000 by October 1st and 12,000 tests per million. And there's been a lot of discussion from Harvard and Margolis and several other about testing. How do we increase testing? So just go to the next slide. I think that's the summary slide. So again, I cannot stress enough that the funding for viral research needs to dramatically ramp up at the vaccine funding level or even more, and needs to be given at the same importance level. We need to see at early start speed and quality of testing is perhaps what we saw. One thing I forgot to point out in one table of that 27 countries or 37 countries is most of these, say for example, Germany's testing level is about 40 to 50% lower than US. France is even lower. Japan is about almost 50 times lower, but they seem to have a very high, very low new cases per million. Even though some of them are spiking, they still seem to be containing in less than 10 and definitely less than 50 per million. So the speed and quality of testing and how early you can start is probably as important, if not more important, the quality of testing. Then we need to move to new cases per million and try to get to 10 per million as soon as we can. Then we need to talk about global collaborative norms. The scientific, as I said, scientific community seems to be sharing a lot better than the economy and the other side of policy decision making that is important. And we need to get a bypass participant involvement from day one and not have half measures. So with that, I'd like to end. Sorry, I ran over a little bit more than. I'm done, Randy.
That's okay. Your use of statistics to predict the future is very novel, very good. There are questions about sharing your reference table, but all of the questions which are mounting up now, you'll probably have to address later because we are over time, and I would like to have Jim add his slides in as I introduce our last speaker, Jibin Savasedi.